I'm Dr. Spiker. For those of you who don't know me, I'm the medical director here, and I've been asked to share with you a little bit about the coronavirus. I'm sure everybody has been hearing a lot about it. There are a lot of questions, a lot of things that are still somewhat unanswered, but I'll try to give you my understanding. I'm not an infectious disease specialist or an epidemiologist. I'm just the medical director here, and so I'll give you my interpretation of what I think is happening, and at the end then there'll be some time for questions.
Dr. Spiker, could you speak up? They're saying at the front desk you're a little low.
Okay. I'm keeping my mask on, and that's probably part of the issue. The reason I'm doing that is because I just got back from a vacation and flew through a couple of airports. It's really just out of precaution that I'm doing that, so every time I come to St. Anne's, I'm putting a mask on. I'm also doing that in solidarity with all of you who have to wear masks when they work here every day, so keep wearing those masks. So what I'd like us to understand today are a little bit about the disease itself and the virus. I'd like us to understand how this presents unique risks to the elderly population that we serve here, and then talk a little bit about ways that we can try to reduce that risk. Talk a little bit about some definitions. There's a lot of terms that are new and that are being thrown around, and it can be confusing. What we hear most often in the media is the term coronavirus. It turns out that there's a lot of coronaviruses. These are common viruses that we've dealt with for quite a while. I see them routinely in the hospital. This just happens to be a new coronavirus. And we call that severe acute respiratory syndrome coronavirus 2. That's a mouthful. SARS-CoV-2 is the name of the virus that was just released. That nomenclature was just released by the World Health Organization. The disease that this virus causes is called COVID-19, or coronavirus disease 19. So the disease is called COVID-19, the virus is called SARS-CoV-2, and the whole family of viruses are referred to as coronaviruses. These viruses are essentially respiratory viruses. They represent probably 30% of what we would refer to as the common cold. We've probably had coronavirus before, we just didn't know it because we weren't testing for cold viruses. The new virus, the SARS-CoV-2, is the one that we're concerned about. As you probably have heard in the media, this coronavirus likely originated from a bat. For whatever reason, bats tend to carry lots of coronaviruses, and there are many, many different types of coronaviruses. Really only about a handful of them that affect humans. You probably also are familiar with the fact that this was first discovered in Wuhan, China, around the end of last year, when they started noticing people coming down with a new kind of pneumonia. And it took them a while to figure out exactly what was going on. During that time, a lot of different people ended up contracting this, and by the time they figured out what it was fairly widespread in that city. The Chinese were actually fairly good about getting it under control by locking things down in their population. And the incidence outside of that province of China really was not that great. And the new cases in China actually the number of them is actually going down. Unfortunately, in this day of travel and ease of people getting from one place to the other, it has become a worldwide condition, what we call a pandemic, meaning that this virus is now all around the world in all continents. In terms of how it's spread, you can think of it as the same way we would spread flu or common cold. It's expelled when we cough or sneeze. When someone who is infected with the virus coughs or sneezes, they expel droplets. Usually, what's been shown in studies is that if we can keep distance at about 6 feet, it's less likely that we're going to inhale those droplets or come in contact with those viruses that are being expelled. In terms of the issue of picking up the virus from surfaces, when you cough or sneeze, some of those droplets are going to land on hard surfaces, tables, doorknobs, whatever. And recent studies have shown that depending on what the surface is, the virus can last between a day up to 3 days on those surfaces. So that was just a study that was released actually just this past week that showed that viable virus can be found on metal up to 3 days after it was deposited there, on cardboard maybe a day, plastic probably also about 3 days. And it can remain floating in the air for several hours after a cough or sneeze. So it is possible to pick this virus up even if you are not around somebody who coughed or sneezed, but the virus is still in the environment. So that's why it's so important that we wash our hands. We're touching things all the time. And then we touch our nose or we rub our eyes, and that's how we can get infected. That's how we can pass the virus on. The other thing that's a little bit unique with this virus is that it can be transmitted by people who aren't physically ill. Unlike a lot of colds, usually when you know when you're sick and that's when you're most infectious, this particular virus seems to be able to be transmitted by people who have minimal symptoms, and those are often younger people. It does seem to have, and we'll talk about this a little later, but it does seem to have a difference in how it affects people depending on their age. So again, remember what happens when we sneeze. We spew little droplets far and wide, and inside those little droplets are millions and millions of little virus particles. So it's a very efficient way for the virus to move from person to person. Again, the importance of wearing masks to protect those around us, not necessarily ourselves. The disease, the COVID-19 disease, the average incubation period is about 5 days. That means that if your body comes in contact with the virus, we would expect on average that within 5 days you might start having some symptoms if you're going to have them. Again, those who are younger have fewer symptoms. And so in China, there were when they studied particularly children, they had little to no symptoms and sometimes not even fevers. In some of the cruise ships, when they tested the whole population of the cruise ships for the virus, as many as half of them had no symptoms, but still tested positive for the virus. Again, one thing that seems to be a little unique about this virus is it tends to affect the elderly to a greater extent than the younger folks, and we'll talk a little bit more about that as well. In terms of testing, how do you know whether you're infected with this virus or not? There is a nasal swab test that the nurses would be familiar with, the same kind of test that we do for testing for flu. So it's just a swab of the back of your nose and throat, and The technology is very similar, testing for the DNA of the, or in this case, the RNA of the virus. You probably have heard a lot in the media about the availability of testing, and there have been some hiccups in the CDCs getting that rolled out in a timely fashion, and I think that's starting to come online now finally, and so we're probably going to see a lot more cases because now the testing is finally ramping up, but for a while it was difficult to get tests. In terms of symptoms, in those people who are going to develop symptoms, most everybody has fever, not all. Depending on the study, that can range from, say, 60 to 70% up to 100% of people develop fever. People feel tired, they have a dry cough, typical symptoms that you might experience with influenza. Maybe not as much headache as you would expect with influenza, but dry cough, fever, and fatigue are probably the most common symptoms that was described in the folks in China. In terms of the disease, there's a definite progression in terms of how sick people get. Fortunately, the majority of people who get this disease have very minimal disease. In the studies that were done in China, over 80% really were very mild. As I said, many of those people didn't even recognize that they had the disease. There's probably 14 to 15% that were sicker, maybe needed hospital care, maybe needed oxygen. And then there's a small percentage, maybe 5% or less, who were very sick. These were people who had severe pneumonia and required respirator support. And again, those tended to be folks who were on the older side, tended to have diseases that would put them at higher risk. So again, those conditions that put people at risk and would be what you might expect as someone who's older. They might have heart disease, maybe diabetes, maybe chronic respiratory conditions. So those are the conditions that put people at increased risk for death from the virus. Again, this is a study with the Chinese experience with the virus, up to 10% mortality in those people who had heart disease, diabetes about 7%, and on down. As you can see, those with no health condition had a very low mortality, only 0.9 in that study. But the thing that I think we need to think the most about here at St. Anne's is how this virus affects people depending on their age. So, as you can see, it's really the people 80 and up who were most severely affected by the virus. In that particular Chinese study, they had about a 15% mortality if they got the virus. Interestingly, children had a 0% mortality. There weren't any cases of children dying from the virus in that particular study in China. So it seems to be that the younger you are, in general, the less affected you are by the virus. Again, this is different than influenza. Influenza tends to also affect children. It can be quite serious for children, but for some reason this virus really doesn't affect children much at all. So this is what I've called sort of the perfect storm for us here at St. Anne's. We have people who are elderly, who have high-risk health conditions, and they're all living together in the same facility. And some, because of physical or cognitive disabilities, may have a hard time doing social distancing or doing hand hygiene. So it is really something we need to think about seriously and consider, the risk of skilled care setting. And this is a case in point that you probably have heard about, was a nursing facility in Washington State. One of the first cases of coronavirus was in Washington State, someone who had traveled from China. The next county over, there was a skilled care facility with about 190 beds, and they started having cases of what they thought were flu. People had high fever, they had cough, it was spreading from resident to resident, and initially they notified the state and said, we think we have an outbreak of influenza. And it wasn't until one of the residents went to the hospital and one of the doctors at the hospital, thought about maybe this is something else, and they did the testing. And as of yesterday, that nursing home accounted for 29 of the 43 deaths in the Seattle area. So it was very, very serious. And this is what can happen if we're not vigilant in a skilled nursing facility. They were the first, it caught them off guard, and just something that we need to be thinking about here at St. Anne's. So, what can we do to prevent an outbreak here at St. Anne's? The CDC recommends, and we have implemented these particular steps since I think the weekend, that we're no longer allowing family members to visit. Again, the goal is to try to prevent the virus from getting entry into St. Anne's. We're asking that everybody wear masks. And remember, these masks are not for our protection, these masks are for the protection of the residents. If you think about, why does your surgeon wear a mask when you have an operation? It's not to protect the surgeon, it's to protect you from him getting germs into your, into your surgery. So it's kind of the same reason. The reason that we're asking the staff to wear masks is to protect the residents. So it's just one more step that we can take to try to reduce the risk. We're screening the residents daily for cough and fever symptoms. We're screening the staff daily for cough and fever symptoms. And we want to do everything that we can to try to prevent someone from bringing the virus in to the facility. Because if it's going to come, it's likely going to come from one of us bringing it here to the facility. Also, we're canceling group activities, canceling dining, anything that allows the folks to be close together, we're holding off on at this point. So what can we expect going forward? Unfortunately, I think we're going to see more in the community. It is in our community. Maybe you probably have heard that there was a case at LGH that was identified already. One of my partners took care of that patient at LGH. There may actually be, and I know that there's at least 70 more tests that are still pending from just patients at LGH. And I think, given the backlog of the testing, in the next few days, there's going to be a number probably of folks who have been tested and are positive here in our county. So it's going to be a while, I think probably weeks or months, until we see things improving. So till then, this is going to be, I think, the new normal for us. How bad things get really depends on how we as a society are willing to limit our normal activities and sort of go along with the guidelines that have been recommended about hygiene and distancing and that sort of thing. You probably have heard the term flattening the curve, and this refers to what can we do to make sure that our healthcare facilities are not overrun by the number of patients in the community. So the tall curve there that you see is the number of cases that would occur if we don't do anything, and the flat curve is what would happen if everybody would try to limit their interactions and follow hand hygiene, and do all the things, all the guidelines that are recommended. So the idea is to keep the numbers low enough so that we don't overrun the healthcare system and that we have enough resources to care for the needs as they develop. So what can we do here at St. Anne's? I would say keep doing what you're doing, and that is providing wonderful care to the residents here. We've always done a wonderful job of taking care of our residents here, and I think we'll continue to do so. Make sure that you wear your masks. Make sure that if you have cold symptoms that you're not coming to work, because we don't know what those cold symptoms might be. What to you may be a minor cold could be the virus because you're young and healthy, and it may not seem like much to you, but it could be significant if that virus comes to the facility. Make sure that you're washing your hands frequently. Remember, the virus can remain on surfaces and we can pick it up. We rub our nose or our eyes and we can transmit it that way. Above all, I would say, don't panic and keep doing the good work that you do. And we'll get through this. The other thing that helps me during times like this is to get out and to take a hike or go for a bike ride or do something like that. That's one way to not come in contact with a lot of other people or viruses. And remember to keep washing your hands.